is recognized for 5 minutes.
I appreciate the comments from my colleagues. I also had a 37-week baby, although mine was born rather a hulk. And if you think your 37-weekers were small, you can only imagine the 23, 24-weekers that I have taken care of in the neonatal intensive care unit as a pediatrician, where I have spent months. And I must say, I find this amendment, frankly, insulting. I took a Hippocratic oath to provide care to my patients. I trust doctors, the ones I worked with in the neonatal intensive care unit, to provide excellent care to babies. I love babies. That's why I became a pediatrician. So let me first say that I find it insulting, and I don't think Congress or this amendment or a discussion of higher education costs needs any discussion of this in this amendment. But now you've brought up the issue of abortion in a discussion of higher education affordability, and I find that rather absurd as well, but I feel like I also can't just let it go. You've taken a talking point from our president, who talks about babies being pulled out 3 days before their due date, and let me just tell you, that is called an induced delivery, and that baby goes to his or her mother, or that baby goes to the neonatal intensive care unit, where doctors like me will take care of him. This is a lie. It doesn't exist. It is a whole bunch of baloney, and it is a favorite talking point right now that everybody seems to have decided is truth, but it's not. And if you want to have a discussion, and again, this is a discussion of higher education costs, but it's been brought up already. If you want to have a discussion about abortions later in pregnancy, let's just have an honest discussion about it. Let's have an honest discussion about the fact that it makes up only 1% of abortions, that these are abortions that have to happen after 20 weeks of pregnancy, and I would note that 20 weeks is when people have amniocentesis. I would also note that nobody, no woman, I'm a woman, there's many women in this room, no woman decides at 20 weeks that she just doesn't feel like being pregnant anymore. That these are difficult decisions, these are fraught decisions, and there is no role for an amendment or for Congress or for anybody else between that mom and her doctor. And these are sacred decisions. I have not seen every pregnancy, but let me tell you, I have seen enough to know that women are well equipped to make these decisions, that there is no role for Congress between a woman and her doctor. And yes, this does involve women, now that my colleagues have brought up the issue of abortion in a discussion of higher education. So in summary, I encourage my colleagues to vote against this. This is, first off, a matter that does not exist. It is a fabricated issue designed to disgust and scare and embarrass. It is not real. And I would conclude by saying that as a pediatrician, I am insulted by the notion that a doctor would do anything but act in the best interest of her patient. I encourage my colleagues to vote against this.
Time has expired.